I'm Shannon Weber with Hive, and I'm here in Oakland. It's April 2015. We're at the Trans Summit. We're sitting outside just having had our lunch, but wanted to take a quick opportunity to talk about some important focus group research about women in PrEP that you guys did. And I'm going to turn this over to you, Maura, to start.
Great.
You want to introduce yourself?
Sure. I'm Maura Riordan, Vice President of Access and Innovation at AIDS United.
And I'm Judy Auerbach. I'm an independent consultant. I worked with AIDS United on this project, and I'm also professor of medicine at the University of California, San Francisco.
Great. So we started this project, or came up with the idea at AIDS United, because it was an approaching that the FDA was considering the issue of PrEP, and we felt like in the United States we knew nothing about women in terms of would they be interested in PrEP, what do they know about PrEP, how would it best be implemented. And so I was lucky enough during that kind of thoughtful phase to run into Judy and talk about doing a little bit of some research together on this. And so the project came together across multiple cities in the U.S. to talk to women who, through social networks, were seen as perhaps at a bit of elevated risk. So we pulled the women together, and Judy's going to talk about the results on that. But I do think it's been an amazing project. It's given voice to a lot of women who we haven't heard from about PrEP. And I think I was also somewhat taken aback by the lack of awareness and the lack of understanding in communities about PrEP, but also HIV in general and why PrEP might be useful. So it left me feeling like whatever strategies or piloting we do around PrEP in communities, we really need to think about how to make that accessible to the reality of women's lives.
Mm-hmm. Right, so Maura and I conspired to put together this study, which was really wonderful. So we did a focus group study. We engaged community-based organizations, women-serving institutions in a number of cities, and we actually had two phases. So the first phase happened before Truvada for PrEP was approved in 2012, sorry. And then the second phase was right after PrEP was approved for men and women at risk in the United States. And so we were interested in seeing, what did women know or hear about PrEP and think about it before Truvada was really allowed, and then after, once it was available, about a year into that, what did women know and think about at that point, once it was real at that point. So we had altogether 10 cities and two groups in each city across the United States, and asked a series of questions about just basic knowledge around PrEP, which included basic knowledge about HIV, which surprisingly a lot of women, even those who attend to these women-serving organizations for family planning, sexual health, HIV prevention, many still don't even understand HIV. So we asked questions about basic understanding about HIV and PrEP, described what it was to make sure that everybody understood, presented the scientific findings so far, and then asked a series of questions to get at what did the women themselves see about the attractiveness of PrEP as an HIV prevention strategy for themselves and the women they know, as well as what might be the obstacles and the facilitators of PrEP information and access and uptake in their minds. So we really have a very rich set of data from these focus groups. And maybe we can talk about what surprised you, since you're the one who thought up this project. Was there anything, I can describe more of the findings in a minute, but was there anything that surprised you right off the bat?
Well, I think I was a little surprised by, across most of the groups, there was pretty high emotion around feeling like this information wasn't accessible in communities, and particularly among women. And so a lot of them looked at this as an option that was really appealing, and that they felt like a lot of women would want to use, which I wasn't sure about that going into this project. I thought it might be much more mixed, so I think that was a big surprise for me.
Yeah, I guess I should mention, the nature of our study sample was very reflective of the epidemic among women in the United States. So we had a preponderance of African American women who were so disproportionately infected. We also had groups from San Diego who were Latinas, who are also disproportionately affected, and the whole sort of wide swath. And so these are women who would be described as most at risk of HIV infection in the United States. And I guess the key findings we had were, firstly, as Maura said, people were just completely uninformed about PrEP. They'd never heard of it, they didn't understand why they hadn't heard of it, and we sort of had a whole spectrum, including anger, that they hadn't heard about, particularly after PrEP was approved for use by both women and men, and both women and men in the United States. And so for a lot of the African American women, that led them down a path about why aren't they hearing about PrEP and who's withholding information that's happened before in their past and things like that. We also found that when we asked about trusted sources for information as well as services, there was some considerable amount of distrust, particularly again among the African American women in Washington, D.C. and Oakland, for example, both for medical systems and for men. And so I think the part about the men was why PrEP might actually be a good thing for them to have access to if they thought they could control their own method of HIV prevention and avoid a whole lot of conversation with men that would involve challenging trust and getting the right information. So that was one thing we found, was some level of mistrust in both of those situations. On the positive side, and the concerns were chiefly about side effects. Would PrEP interfere with their birth control, or for women who are using illicit drugs, might it upset their high? We heard a little bit of that. But mainly that diabetes, any sort of other medications they're on, that was a primary concern. And the other deep concern was, of course, cost. Who's going to pay for PrEP and how might they be ensured that it would be available? And most of the women thought, we know we're at risk as much as anybody in the United States for HIV, and if it's in the public's interest that we be protected, it should be free. It should be paid for by the government and public services. So strong feelings about that. With regard to facilitators, most of the women thought about the places where they would seek health care in general, like family planning clinics and the community-based organizations, in fact, where these focus groups took place, that provide really supportive services, would be good venues for PrEP information, and to the extent they could prescribe as well. But they also had all kinds of novel ideas about how to inform women in their communities through mobile vans and putting up flyers in the Y or the beauty shops or whatever, just wherever women might actually see the information. So I think those are the key things that I would mention.
And so what do you think, Judy, are some of the next steps that we can kind of use this rich data and bring it back to communities? What do you think we can do?
So I think our focus group data provide really the most comprehensive sense of what U.S. women think and know about PrEP, or what they might imagine would be the ways to access information and services. And I think altogether we have close to 200 women in these groups, just to put a number on it. And a couple of next steps I think are happening. One is we're here at the Trans Health Summit, and there's actually conversation about trans people, trans women in particular in the context of women, but also trans men, and how PrEP is being thought of and made available or not yet to trans women, and to separate out those women as compared to how they've been treated in the HIV discourse, which is men who have sex with men who decided to be female. So I think some focus on trans women who have absolutely disproportionate risk of HIV infection, and a lot going on in their environments that put them at risk, where control over a prevention strategy would be really important. And then these demonstration projects looking at, or not even just heading to implementation at this point. I'm not sure how much more demonstration research we need. We need some, and there's some going on, but to actually look at providing PrEP in different venues to see what would be the most effective ways for women to access PrEP, trans women, cis women, everybody. So whether that's family planning clinics, CBOs, clinics of other sorts, who are the best providers, what are the best venues for supporting access and uptake and adherence to PrEP.
Yeah, I think the data is just another reminder of the intersectional framework that's so important in working with women and everyone, but that we need to really figure out where they're going, where they've got trust already built, how the information can be heard, and how they can experience that in their social network. So I think that is the next challenge as well, is how we do that in communities.
Absolutely.
Thank you.